the ones we use for perio. The conical tip, and this is the beauty of lasers, is the precise cutting of lasers. I mean, if I have a little piece of tissue on the mesial number 9, I could reshape the piece of tissue without using a blade or a handpiece or anything else. I could use a laser and actually get that little piece of tissue. And that's what the set we're going to show you. We use the cylinder. The cylinder is really integral when we're doing periimplantitis. These are the two that you're going to use for periimplantitis. We'll go over that in a couple of minutes, but those are the most important ones. So these are the 5 tips that I find are most important. Now you may find other tips that you like. I'm not saying that, but these are my criterion. So when you understand tips, you also need to understand tip geometry. Because what the tip what the tip looks like, the tapered tip, this tip right here is tapered, that is perfect, like I said, for fine cutting. And if you look, you'll see why. Where the radial tip actually gives you a ball of energy, 85% of the energy coming out the sides, only 15% coming out the tip. So with that tip, it's going to make a difference in cutting. So let's try this now and see what it looks like. So I took each tip individually. I actually have it sound. I want you to hear what it sounds like too. So you see that, you see that when we're cutting with the chisel tip, it's like a chisel, okay? Again, this is on dry meat. We have it on, I'm gonna put it on wet meat later. Now this is the cylinder. See the difference in cut? So you need to understand that what are you trying to accomplish when you use your laser? This is great for reshaping tissue. This is great for a cut or reflecting a flap. And like I said, the next one is the conical tip. The conical tip is very fine, okay? And each tip has this finite amount of energy you can put through the tip. Understand that. Look at the difference in those cuts. Okay? So this is now the conical tip. The conical tip is good for fine cutting. Again, let the laser do its work. The laser tip is not something you pull through the tissue. The tissue is the melting away under the laser tip. And I have a very light grip on this. You can pull this out of my hand right now. So now we're going to go to the radial tip. And if you look at the radial tip now, you almost see like a V-shaped cut. And that V-shaped cut is because the tip looks like a pencil. So the energy is coming out the sides. You can see the type of cut that is compared to a chisel cut. And then finally, we're going to go to the flat variant, which is we use in perio all the time. And there's your flat variant. Okay, so this is, I like to show this so you can kind of see what tip you want to use. What are you doing? Okay, so you have the option to pick any tip you want. And if you want to make a deep cut, you're going to use a chisel. You could use it to reflect the flap. You could use it to clean, everything else too. So those are your cuts. Okay, so understand, went too far. So understanding that, now the next thing is pulse duration. Okay, how does pulse duration make a difference? And I love being, when we do hands-on, and somebody says, well, it's not cutting very well. And I do one thing, is I push it from 300 microseconds to 50 microseconds, all of a sudden you get a cut. Or somebody's using it on VLP and saying, well, this is not doing anything. But look at that. It's no ablation on VLP. So let's kind of show this on meat also. So this is on wet, okay? And now listen to the noise because I put it on slow motion in a minute. And look at what's happening to the cut. This is wet. I'm going to do each one on, this is MSP now. Again, what are you trying to accomplish on the patient? Listen to SP now. But look at the depth of the cut compared to that. Totally different. When we get to LP and VLP, you're going to see very little cut. You see much of the depth of the cut? So when you're cutting on LP and you're telling me it's not cutting, I'm going to say, well, you know what? Change the pulse duration. Give it more energy and less heat. And now this is VLP. Do you see any cut? Remember we said it's a heat. It's not an ablation, it's more heat. Why would you want to switch? Let's say you have bleeding. Look at QSP now. Look how fine that cut is QSP compared to SSP. Remember, QSP is almost 100 microsecond pulse, very fine pulse. So what do you want to use? So let's take that now and put it on dry meat. Okay, this is a wet cut, we're gonna do it on dry now, because it makes a difference if you use with or without water. Remember, if you're using it with water, you're using the photons that energize the water particles to expand and explode and cut the meat. But now I'm looking for the water in the tissue to cut. How does that make a difference? Watch this. Look how aggressive the cut is at SSP without water. Yeah, slow speed. Look what each pulse does. Look how deep that goes. So if you're using it at water, understand it's going to be very aggressive. Understand that, okay? So this is MSP. Again, you're the operator. You get to choose all this, okay? But it's not just pushing the button. So look how deep that cut is. This is SP, 300 microsecond pulse. We're going to 600 microsecond pulse next. Here's the difference in the pulse, look at the difference in the cut. That's totally different than that. So if you're using LP and not cutting very efficiently, you'll understand why. Your pulse duration is 600 instead of 50. And then VLP, look at that, hardly any cut at all. So again, understand you have tip geometry, you have how much energy you're putting through there, but more importantly, you have pulse durations. Pulse duration, how long is that actually firing? Now let's put it at QSP, quantum squared pulse, and compare that to SSP. You can see it's a finer cut. So again, understand what you're trying to accomplish. So the rest of this lecture is going to be on how we use this. This is not a how-to lecture, okay? This is understanding what we can do from easy to complex. Okay, you can see the depth of the cuts without water compared to water. Remember, water attenuates it because the water is being absorbed by the laser, and the photons energize the water particles to cut. So if you're using it without water, you can, but it's going to be much more aggressive. If I'm reshaping the tissue around number 9 and I'm turning the water on, it may slow down the cut. And if I turn the water off, be prepared. Depending on what, if you had SSP at 50 millijoules, you're going to cut the living daylights out of the tissue. Back off. Always start low. Back off. Because now you're going to be thinking about grafting. So again, understand 50 microseconds compared to 1,000 microseconds. Look how long that pulse is on compared to 50 microseconds. They have total energy here at SSP. Again, SSP, look at how many the peak power here compared to the LP. So understanding what you're doing rather than pushing a button is most important in lasers. I hate talking about laser physics, especially Saturday morning, but very important. Again, you just saw this happen right in front of your eyes. Okay, so again, the more you go to the right, and I know the new lasers don't have this kind of interface, but it's the same thing. You have the width of the pulse. The width of the pulse. So VLP is a very long pulse compared to SSP being a very short pulse. QSP being a very fine pulse. Again, if you have 20 hertz here, that is times 5 for QSP. Okay, because QSP is taking that wave, breaking it down to 5 small pulses to decrease the ablation cloud to make a clearer cut. And by making it 5 small pulses, you're multiplying your hertz times a factor of 5, which means 100 hertz. If you want to do fine tuning around anything, you're going to use QSP. You're going to use QSP, with or without water. Again, your choice. Understand, more aggressive without water. So I always tell people that, so this is the interesting thing. 200 millijoules QSP is about 0.8 kilowatts versus 200 millijoules at SSP is about 2 to 3 kilowatts. You understand why SSP is it breaks apart the tissue more. Now understand also that when we clean implants, a lot of times we use SSP because of this. And QSP when we're cleaning counters off the root surfaces of teeth. Okay. Now let's talk about this. if you use it without water or with water, what happens? So let's say I'm using something with water, so my main absorption is the external water, that's the water in the back of your unit. If I do that, the heating is very little. In fact, you can take the laser, I do this all the time, and put it almost right on your hand, and it won't hurt. Turn the water off, and the pain is incredible. You won't last 5 seconds. Understand that. Now, I do that for every patient, because they don't know what pulses mean. You put that laser in their mouth, it sounds like a jackhammer going off in their head. But you show them on your hand, look, this is the laser. See, it's like power washing a deck. See the water particles hit my hand? When they see that, you can see their body language is kind of relaxed. So understanding that when you do that, though, you may have a little bit more bleeding. And this is when you start to think about increasing your pulse duration. If I get bleeding when I'm cutting, I'll increase my pulse duration to increase the amount of heat. Understanding that my depth of the cut will decrease because I don't have as much energy cutting. Again, understand that interplay. If I'm going to turn the water off, okay, and then you're going to have a different thing. So anyway, understand that if you turn the water off, it's going to be healing a lot slower. And the bleeding may be less, but it may hurt like the devil. Because now you're working on the water in the tissue and breaking apart the tissue. Now, with that being said, again, it has to do with our wavelength, which is the 2940 wavelength. And what does the tissue look like? Is it edematous? Is it fibrous? Is it bone? Is it soft tissue? What is our tissue? Is it an implant surface? What's our tissue? What are we dealing with? And then how much exposure time are we getting, your pulse duration? And what's our power density? What's the energy level at the level of the tissue? And that will make the difference with your cut, as you can see on the pieces of meat I just showed you. Okay, now let's go to ND, because there is an ND ag in there, which is the beauty of the Lightwalker. Okay, I mean, people always ask me, how do you compare it to other erbium YAG lasers? I said, well, first of all, you have 2 lasers in one box. That's the beauty of it. So, I mean, I started on a lot of different lasers. I started on a Millennium laser. I went to a BioLase. I had cut multiple diodes. I'm now in the process of getting the Lightwalker Max. Guess what? It's the evolution of lasers. Things change. But anyway, on the ND side, you have the same thing. You have a 100 microsecond pulse or a 650 microsecond pulse on almost 6 times longer. So how does that make a difference? So first thing, I don't know how many of you have a power meter. We talk about power meters, okay? Steve and I always talk about this because this I did a couple years ago, and you have to see what happens, okay? So this is the power meter I use. This is my NDAG. So we put the power meter on, fire the laser, and this is the setting I get, 1.33. Now what does my laser say? Oh, the laser says 4 watts. I'm getting 1.33 out of my laser. Do you wonder why I'm not cutting? Okay, so let me just cleave it. Just a simple cleave. Okay, now let's see what the power meter says. Just cleaving it doubles the power meter. Doubles. Okay, so let's start playing with this. Let's bring it up to 5 watts. See what happens. Now, why does it take so much more energy? Well, my fiber may be old. My port may be dirty. The back of this fiber may be damaged. Who knows? And my machine may be older. Okay, so now I have 169. Now I bring it to 5.75. Okay, fire it again at 5.75. I'm still not there. Okay, now let's bring it up to 6. Still not there. So this is why I say you need to have a power meter. Now this is at 7 watts on my machine, a little bit over, so let's bring it down a notch. Okay, we'll bring it down to 6.75. One more time, we'll try it. Four watts on the dot. So 6.75 watts on my machine. Now, is the machine at fault? No. Because I don't know what that fiber looks like. How many times have you used the fiber? Is it a brand new fiber out of the box? When was the last time my machine's been calibrated? When was the last time that port's been cleaned? You know, this is an original light wafer, probably 2012 vintage. It's not bad, I could use it, but we just need to calibrate the lasers. So when you're using the laser, and you're telling me when you're doing perio, well, this doesn't cut very well, did you calibrate it? So these things have to be calibrated. Now, as a periodontist, this is really important, because if I'm telling you to cut at 4 watts, and you're not cutting at 4 watts, if you have it on your machine, remember it says 2.6 on a cleave. So with that being said, now let's take it to the meat. So this is 20 hertz, okay, at 4 watts. That's the cut you should be getting. But let's just bring it to 5 watts and see what happens. Okay, remember when you get up there, you're gonna start seeing a lot more. Now this is VLP, 650 microsecond pulse. You wouldn't normally cut at this, you do more coagulation. Okay, I wanted to show you what it does. So if you make a mistake and use VLP because you're not paying attention, and the tissue's getting melted away, hope none of you have ever done that. It's easy to do if you're busy. Make sure you pay attention to what you're cutting at. So now let's go to MSP, which you should be cutting at. Totally different. So that's at 4 watts. This will be at 5 watts. And again, you need to watch the tissue. Okay, this is all about watching the tissue. And if you think it's not cutting, and all of a sudden you use too much energy, and you look back at the tissue 20 seconds later, and your papilla have now lost the outer epithelium because you overheated the papilla, which is overcooking it. It's because you use too much energy. So again, I showed you about the power meter, but just don't go randomly changing your energy levels because you think it should be better. Okay, understand what you're doing. Okay, this is pretty much an exact science nowadays. Okay, so now what happens if I take the same thing and I bring it to 5 watts, but I'm going to increase my hertz to 40 hertz. Everybody wants to increase their hertz. So how about I just increase the hertz? Well, when you increase the hertz, there's less time for cooling. But look at what happens to the tissue. You almost melt the tissue away. This is at 60 hertz. And this is at 80 hertz. Now watch what it does at 80 hertz. What does it do at 80 hertz? Do you ever get that bleeder that you couldn't stop and you're trying to use a pulsed laser and it doesn't work? You say, well, this should be coagulating. It's a pulsed laser. It's pulsing. And every time it pulses, it's breaking apart the clot. If you have a bleeder, put it on 80 hertz. It'll automatically go to 5 watts. The machine will automatically kick there. And just touch it. You see how I touched it? Don't hold it there. You can burn the living daylights out of it. That's how you coagulate. It works almost like a bogey. But again, don't hold it there. So anyway, a little bit about NDA. So now that you've seen a little bit about what's going on with the different tips, different way we use, now let's go over procedures. Again, I'm going to go over a lot of different procedures in a short period of time. So this is not an advanced class. So it's going to, when I go over all this, you'll see how much there is to really show you. I'll be here 3 days and we're going to go over everything. So this is just a simple frenectomy. Okay. Oh, that's the next lecture. Okay, simple frenectomy, chisel tip. Why a chisel tip? Because a chisel tip makes sense to me. It's flat, it's going to cut like a knife. This is a tissue forceps, okay? We're going to pull the frenum, and I do use water when I do these, okay? And I do use Erbium when I do this. Could you use Nd:YAG? Well, it's going to burn the living daylights out of it. The difference being Nd:YAG going up to 500 cell layers deep compared to Erbium being 3 to 5 cell layers deep. Big difference. I'm working on the surface rather than burning living daylights out of the patient. So this is how simple a frenectomy is. Okay, again, let the laser do its work. Now we could use the chisel tip two different ways. We could use it that way and we could use it this way also. Again, I am not pushing on this chisel. By the way, this is the straight attachment. If you not wanting to know why we use straight attachments, it's ergonomic. Instead of doing this, I'm painting. If I move the way it's okay? But this is a simple frenectomy. And you know, the funny part about this is back in the day, every laser company wanted to sell you a laser because of frenectomies. I was like, are you serious? This is probably the easiest procedure you can do. This procedure should take you no longer than 5 minutes. Maybe even less than that. Okay, that's what it feels. It's not a tough procedure. We're scarring down to bone. Oh, could an erbium touch bone? Absolutely, it can touch bone. Okay, that's the beauty of erbium. Okay, now what are we going to do next? Somebody said there's a lot of bleeding. Well, we have an NDA. Let's use our coagulation at VLP to coagulate. Again, you have two lasers. They're right there. That's where she started as. That's where she finished at. Okay, how about taking off a fibroma on the tongue? Am I going to use NDAG or erbium? I will use erbium. Again, 3 to 5 cell layers deep. Minimum trauma to the patient. Okay? But we'll use an NDAG to coagulate. And we do biopsies these. We biopsy anything we take off goes to biopsy. Now look again, chisel tip. Could you use a conical tip? Absolutely. You'll be here a lot longer. Again, use the tip that makes the most sense. Sometimes it's trial and error. If one doesn't work, change your tip. Go to a different tip. Okay? Could you use a variant tip? Yes. Could you use an end cutting tip? Yes. Could you use a radio firing tip? Not recommended, but you could use it. Okay? The tongue's hard because you're fighting the patient. They want to pull the tongue back and you're pulling the other way. Okay, so that goes right to the biopsy bowel. If the massive tissue is big enough, you're not going to destroy it. You can do it with a laser. If it's too thin, then you got to do it with a blade. Then I'll take out any residual. Now, see, I turn the water off. Do you understand? Okay, see how the water is there? It's almost like creating what we call a laser bandage in there. Okay. And then you're going to have a little bleeder in the middle. So we're going to take our NDAG, and I showed you, now you're going to bring it up to 80 hertz. It's going to automatically go to 5 watts. And you're just going to touch the tongue where it's bleeding. There we are here, watch. See how I touch it? That's it. That's how fast you go. You don't hold it there. We're done. Pretty simple, huh? Could you use a blade? Absolutely. Would I have to put a suture in? Probably with a blade. Okay. Try suturing the tongue. Okay. Now, how about an ossifying fibroma? Again, I go through a lot of these cases. Oh, too far. This ossifying fibroma, how do I know? Because I biopsied it. I mean, I wouldn't know if I'm looking at it. It could be any mass. So again, we use a chisel tip because it makes sense. Okay, we hold the ossified fibroma. There is a little stalk on it. Okay, and we're just going to cut on it. As we're using it, the laser energy is making the water particles cut under there, and it's just releasing it as you pull. And again, it's a big enough mass that it's not going to hurt. Somebody said in that pathology, they still have plenty of things to do with pathology, plenty of tissue there to diagnose with pathology. If it's really thin, I use a blade. Always use the thing that makes the most sense. Okay, always use the thing that makes the most sense. The laser, as I've always taught people, is a tool. It's not a magic wand, it's a tool to make your job so much better and easier. I always tell people, if I didn't have a laser now, I probably wouldn't practice perio. It's definitely taken over our profession. And the problem is a lot of the dental schools still haven't regret. I mean, I was just talking to one of the dental schools. It was all about the bottom line. And I said to him, I said, this is not 1995 anymore. This is 2025. Your residents are coming out not knowing what a laser even does. Okay, so now I'm reshaping the tissue, and then I'll use the NDAG the same way to coagulate. And again, this, we won't even put a suture. See how I can just take off that tissue real reshape it. And then coagulate. Patient leaves like that, no sutures. Okay, how about when we have thick tissue around implants? Erbium or Nd:YAG? I would never put an Nd:YAG in there. Okay, you got metal here. So how about an erbium? Oh, erbium is so easy. Now, again, not only look at what I'm doing, but look at my hand speed. I'm not like this. This is not, that doesn't do anything. The laser energy has to focus. It has to make a difference. But you can reshape all this tissue when you're doing implants. So you have an excellent area when they go to restore. All this tissue will be reshaped. Okay, with or without water, doesn't make a difference. How aggressive you want to be. I always try to finish with water, but not necessary. Okay. Again, reshape your tissue. How about the distal of tooth number 2? Let's say you have a lot of tissue on the distal of tooth number 2. And you don't have bone loss, you just have a lot of thick tissue. Okay, there's my tissue there. What am I going to do to take that off? I'm going to use my big cylinder, turn the water off. See, this is water 0, and I'm going to reshape the tissue. And this is pretty quick. Okay, you can use 30 hertz if you want. Okay, 70, 80 millijoules. You can play with that depending on your tissue. The cylinder, you can put the most energy through. You can put 600 millijoules of energy through there. 600 millijoules. Okay. So don't be afraid to put more energy. Just watch the tissue. But look how I can reshape that tissue so easily. Okay. Is it better than a blade? You better believe it's better than a blade. Would I use an Nd:YAG to do this? No. There's not a whole lot of pigment there to even cut anything. I'd be burning the tissue rather than doing anything else. So again, just reshaping the tissue real nice and gently. So by the time you're done, this is going to be flat. Okay, you can see, and my pocket's going to be minimal. Using the laser as a tool. Using the laser as a tool. That's me cleaning it. When you're using it without water, you're going to get a lot more debris on the end of your tip. But just clean it. That just a wet Mr. Clean, basically. How about lichen planus? You see lichen planus? Not lichen planus, excuse me, non-specific leukoplakia. So you can see it's up here. Where's this biopsy? How do we know it's been biopsied already? So how do we take it off? We take it off, again, just going in there and painting it off. You can paint the white cells off. Okay, this is with the water on, water off. It doesn't make a difference, but you paint the white cells off. Again, it's non-specific leukoplakia. Why would I want to take it off? Why just leave a white lesion? You know 50% of them turn into squamous cell? 50%. If you don't think that's a fact, guess what? Tell me that patient that lost her husband that I talked to from non-specific leukoplakia that was never treated and oral cancer and died. Tell her that doesn't make a difference. So why don't we take them off? Because it's simple. We have a laser that can take it off. Again, dial it in so your erbium can take off all the white cells. Wait 6 weeks, go back one more time, because some of those white cells will come back. Wait 3 months and go back, maybe touch it up. Keep an eye on it. If it's on the floor of the mouth, wrapping around the tongue, guess what? You can do it with a laser. And you don't have to go very deep to do that. You're taking off the cells. But make sure it's biopsy first. Okay, how about removal of a bony spike? You ever have something that, patient goes, if I feel right here, there's a little bone chip right there. What did we used to do before? Lay a flap, take a bone file, and file it down. Nope, let's not do that anymore. So here's my bone spike. It's on the buccal, between some implants, it's right there. You can see it sticking up right there. So we numb it, we take the chisel tip, I'm gonna make a little incision here. Okay, I'm gonna make a little incision right there. Okay, and as I do that, I can feel the bone chip right under there. Okay, see it right there? And I just keep on working it, and my chisel takes that bone chip right off. Again, understanding how lasers cut soft tissue and how they cut bone, and how we have to adjust the settings when you get to bone. We're going to go over that in a minute. We're going to show you how we cut on bone in a minute. Okay? Because it's different. On soft tissue, you may wanna use 30 hertz. On bone, you may wanna use 10 hertz, 5 hertz, we'll go over that. Okay. But when you're done, look how easy that was. Okay, we'll go back one more time to make sure it's nice and smooth. But look at the size of my incision. Okay, it's like nothing. Same thing when you have a bone chip on the lingual. I mean, a lot of times you'll see that after extractions. So easy to take care of nowadays. So easy to take care of. Patients don't even feel it. Unless you. So when you're done, we use surgical glue. We'll put a drop of surgical glue on top of that, and we are done. There's my incision. Pretty simple, huh? Again, so many things you can do with a laser that you never even thought of. And this is just some of them. Okay? The more you understand about the physics and how a laser works, the better it is. How about a fixation screw? This guy came in and he needed an implant. This is my, I'm placing the implant. It's not the implant placed. That's just in the software. But you can see where the screw is. It goes right through. So I know where the screw is because I've looked at my cone beam. I measured it out. I can see exactly where it is. So I make my incision right where the screw is, and I measure now from the cone beam where that is going to be. You see, I'm using a blade. Could I have used a chisel to do this? Absolutely, I could have. Okay. But I decided at this point to use a blade. Totally up to you. Totally up to you. We're going to show you something with flaps. We're going to lay with a chisel. So you can start seeing the screw somewhere in there. See, it's right there. So I'll use my laser now to uncover that. And again, you can see it right in there. Okay, again, I like when you're using a chisel tip, if you have a straight handpiece, see what I did? I turned my fingers and the chisel just turns with me. Rather than you're using a contra-angle, you have to take it out. So I'm measuring it from the cone beam, I know right where it's at. And all I do is take the bone off right on top of it. I'm relaxing the flap, see how I'm reflecting my flap with my chisel? And you won't hurt the metal. I mean, you won't, chiseled, erbium will not cut metal, so it's reflective property. So there's my screw. I go right in the threads of the screw, not the threads, in the cross hex. You can see it right there right now. You take the bone right out of there, okay? See how I'm taking the bone right out with my chisel tip? And then unscrew it. Makes it pretty simple. And we will be placing the implant that same day. But it's easy to remove bone. Again, you notice it's not sparking off that or anything, okay? It's beautiful, the erbium is beautiful for doing this. But just take your time. Take your time. And then I'll just go ahead and unscrew it. Okay, other things, crown lengthening. Crown lengthening number 9, soft tissue, erbium, okay? Erbium. Chisel tip, I like the chisel tip. If you like a conical tip for like the papillas and festooning, that's fine too. But you can see, I like water. You can do it without water, it's gonna be more aggressive, as I showed you. Water slows your cut down. And for those of you who haven't used the laser a lot, I would highly, highly, highly suggest water so you don't cut too aggressively. This is an SSP, okay? This is at 30 hertz. If you say I want a smoother cut, bring it to 40 hertz. You want a smoother cut, bring it to 50 hertz. You want a smoother cut, QSP. It's 100 hertz. So understand again what you're doing. So I'm gonna reshape the tissue, okay? And when I get the tissue to where I want it, then I'm gonna reshape the bone. And their biological width is important, okay? So let's go to the next one. So I'm gonna mark my tip at 4 millimeters. That's my biological width on this patient. I measured it around, okay? And we're gonna go up to that. And I'm gonna make a bunch of cuts all the way around. Now the bone has to be thin here. You can't do it if there's big exostoses here. Okay, otherwise you create infrabony pockets. So understand what you're dealing with. Again, there's the chisel tip, and I'm with the straight handpiece, I'm actually turning it as I'm walking it around the tooth. You notice that the tip is flat against the tooth. Okay, don't put it into the tooth. You'll groove the tooth. Okay, this will cut tooth structures faster than it'll cut bone. And as you do that, then you're gonna go around and just smooth it all out. But you see I'm going right down there, and it's just the bone just melts away. Just melts away. So that's a closed crown lengthening. This is an open crown lengthening, so the flap is open, and I'm putting it right on bone. Why am I doing an open crown lengthening? Because I need to see where the bone is. I need to see where the bone is. Okay, so it's the same thing. So I'm smoothing it out. Could I use a rotary instrument? You can, but this will never cut the tooth. It's end cutting, unless you put it into the tooth. Again, look at my angle, okay, right parallel with the tooth. Okay, how about posterior areas? I love it in posterior areas because between these two molars, I can't get a rotary instrument in there. So it's perfect for the interproxy between the molars. Again, this is a cylinder. You're not going to use a 600 micron. You're going to use a 1300 micron. Right between the teeth. How about extraction sockets? You ever see this after you're bone grafted 12, 14, 16 weeks later? Do you wish it looked something like this? Or do you wish it looked something like this even? This is the tooth that came out 12 weeks later. This is what our extraction sockets look like. Big difference, isn't it? Would you rather put an implant in something that looked like that? Or something that looks like that? How do we do it? Real simply. Every extraction socket is debrided and degranulated. Every extraction socket has an erbium YAG laser in there to debride and degranulate. I go around there, and it doesn't make a difference what tip you use, but you go around and clean the extraction sockets out. The healthy vital bone, you strip out all the ligament, you strip out every bit of granulation tissue, every bit of it. Okay? Go in with the hand correct, make sure you get it all out, go back with the erbium, and then finally you go with an NDA to create your clot before you put your bone graft in. Okay. How about you have something that looks like this? The guy said, I want to save my tooth. I said, I think it's time it goes. I think it's time it goes. So this is how simple it was to take the tooth out. One twist, tooth is out. Don't you wish all of them came out like that? Okay, so when we debride this though, we're going to debride the socket the same way. This is a variant tip. Could I use a cylinder? Absolutely you could use a cylinder. Could I use a chisel tip? I don't care what you use. But I'm going right on the bone. Okay, you see me going right on the bone. Am I about a millimeter away? I'm just cleaning the bone, the healthy vital bone. I want bleeding marrow spaces looking at me. I don't want granulation tissue. And a lot of these, especially endo teeth, always have something at the apex, whether it be cement, gutta percha, or something. Just takes it right out. Then after you've done that, you're going to go into your fistulas. Okay, we're going to go into these fistulas and clean each fistula before we go in and bone graft. But you see how meticulous I am, and this is why I look so good. Okay, so go in and make sure it's all clean. Go back with the erbium one more time. And then we'll clean the fistulas. Okay, so we've done that. We've got the socket clean. Now go in the fistulas with my erbium too. The best thing is the radial firing tip. Remember the ball of energy. It's cleaning out the epithelial lining in there. You go right into the fistula, all the way around there. And then I'll go with my NDAG to kill any bacteria. Pass it back and forth a couple times, okay? Right into those fistulas, and it feeds right into your extraction socket, obviously. See how I'm moving it back and forth? Just kind of making little circles to make sure I got 100% of it all the way down. Radial firing tip. This is what the immediate implant's gonna look like. Look at this. See the residual tooth there? That was all taken out with a laser. That's the immediate implant. Here's another one. So every implant osteotomy is also debrided and decorticated. This is an implant osteotomy. Okay, and you're gonna see that when I'm in here, see I have the laser right against the bone. Why? You see how dense cortical bone that is? You're gonna put a dry implant in a dense cortical bone? You're probably gonna have some kind of reaction, because the body's gonna say, what is this? There's no blood supply. But if I decorticate this, see my laser beam, I'm not pushing on the bone, it's not touching the bone, it's about 1 millimeter away. We're gonna show decortication in a minute. Okay. That's the thing you wanna do. And so now you're gonna see the bleeding starting to occur in there? That's what you want before you put your implant in. Every implant osteotomy is debrided and decorticated. How about you have a problem when the implant fails? This, obviously, you can see how easy that was to take that implant out. Don't you wish all explantations were like that? We use the chisel tip to actually reflect the flap to clean that. We use a chisel tip to go back and forth. Could you use a blade? You can. We use a chisel tip to create the flap. And that will clean that out. How about perio defects? Well, here's the perio defect, and here is our radial firing tip right in there. You can see it right in there cleaning the defect out totally. Oh, it's flapped, of course. Lasers never said you cannot flap the area. It's a tool to do whatever you do even better. I can remove 100% of the granulation tissue down to bone by using that. You can see I get it right in there, all the way down the bone. Then you can treat the root surface also at the same time, and the frication before you bone graft. Okay. Again, lasers never said it had to be minimally invasive through a pocket. How about removing calculus? Well, obviously you all know that if you take an end cutting instrument and you hold it parallel, the water particles will hit the calculus and just remove the calculus real easily. This is the beauty of lasers. Well, I can do that with a piezo. Sometimes you can't reach it with a piezo. Sometimes the calculus is so tenacious it won't come out. These are shock waves hitting it. These are shock waves hitting the tooth. Okay. Again, you're going to go over this with hand curettes and piezos to make sure it's perfect. But that's how simple it is. Why? It's this part. It's the water particles getting energized by the photons to expand and explode. Those explosions are what's doing it. You need to understand how the erbium actually works. Those explosions will blow off the calculus. Okay. It will also work on implant surfaces, which makes it ideal for implants. Ideal. Understand when you're doing implants, though, you need to understand what fluence actually means. Because if I tell you to use a cylinder, you want to use a radial firing tip, not a good idea. Not a good idea. Because this is what happens when you use a radial firing tip. Okay, even though it fits the threads perfectly, well, I'll just use this instead. Oh, that's a great idea. It's just arc weld. Okay? Don't use a radial firing tip on an implant. This is what it looks like after a radial firing tip. These are the things that when people don't listen, that I get emails saying, well, this is what my implant looked like. And I said, well, you use the radial firing tip. Yeah. So please, no radial firing tips on implants. Okay, it just pits the living daylight. Because again, let's look at this. If this is a cylinder, your fluence is 100 times what the cylinder is. If I give you, so on the new lasers, for those of you who have the new GUI, it says what tips you use. I made sure I put that in there, that it says use a chisel or a cylinder. It doesn't say a radial firing tip. So we use the flat chisel for cleaning implants, and it's much nicer. Take the calculus right off, and you can use it two different ways. Two different ways. So again, lasers are great, from easy to complex. From easy to complex. How about uncovering implants? Real simply, we use a erbium to uncover. Okay, you could use it at 30 hertz. You could use it, 50, 60, 70, 80 millijoules. And when you're done, you can see how nice that looks. And the same day, we'll put the heating cap on. And you tell me I uncovered it right now, because it was just uncovered. Did you see a lot of bleeding, by the way? That was an SSP with water. People always say you can't cut with SSPs, you're gonna have so much bleeding. You can control that.
Doctor, can you take the impression the same day since it's not?
You can take impressions the same day, absolutely. Absolutely. Okay, here's, how do we treat implants? We treat it with erbium. Here's the calculus here. This is an old implant. It's a titanium plasma press fit implant. And this is our laser cleaning the implant surface. Remember the shock waves of water hitting the implant, cleaning out all the pits and grooves. Okay, like a brand new implant. That's the way the implant should look. Okay, that's the way the implant should look. Not like a mess with a radio firing tip. How about ridge augmentation? They wanted to bury these two implants. They didn't want to take them out, so we decided so we could use a radio firing tip, de-epithelializing the flap so I can overlap one flap over the other. We could de-epithelialize the palatal, and we'll de-epithelialize the inside of the flap, okay? And that way we could wrap it around. And I'll show you the final in a minute, but again, using the radial firing tip, the side of the radial firing tip, to de-epithelialize the flap. That's what it looked like before. At 4 weeks. And that's what it looked like before, and that's what it looked like afterwards. Soft tissue grafting. How about when you're doing gingival grafts? You can de-epithelialize the inside of the flap. Do you want to put a flap with all that epithelium against the tooth? No, you want to put connective tissue. The laser is the only thing I know that can de-epithelialize the inside of a flap. Look how delicate that is. You want to try a burr in there? I doubt it. So you can use a laser to de-epithelialize that. Look how nice that works. Takes the epithelium right off. You can also de-epithelialize the papilla. Okay, again, the radial firing tip. You can see the epithelium just come right off the papilla. Now you have connective tissue against connective tissue. Okay, so now you can have grafts that go from here to there, and that to that, by doing which biologically is acceptable. Again, using the laser as a tool to make this happen. Okay, how about bone cutting? Okay, do you want to use higher hertz? Well, it's far faster, but it generates a lot of heat. So let's take a look on bone. Okay, this is a piece of pork chop, basically. Okay, this is at 3 watts. Okay, this is a chisel tip, 20 hertz, 150 millijoules. I want you to see what happens to these cuts. Okay, works pretty good. Well, how about I bring it down to 15 hertz? Hear the difference in the cut? A little slower cut, more defined cut, less burning. Okay, there is water here. Now let's bring it down to 10 watts. Again, understand how a laser cuts bone. Am I using it at 30 hertz? No. If I'm using it at 40 hertz? No. Not on bone, but maybe on soft tissue. So when you go from soft tissue to bone in the same procedure, you're going to adjust your settings. Okay, understand that. And this is at 5 hertz. Okay? Look at that cut. Look how deliberate that is. Look how clean that is. So again, understand how to cut bone. But how about I want to use a cylinder? Well, understand the cylinder is not going to cut the same way. Okay? Again, 20 hertz. Let's bring it to 15 hertz. You see the same kind of cut as a chisel? Absolutely not. Understand what you're using. It makes a hole, but what are you trying to do? This is great for crowning things. Okay, great for crowning things. See the hole getting deeper? When I 10 hertz through in millijoules. Again, a cylinder you can put a lot of power through. Learn how to cut bone. Totally different than cutting tissue. Totally different than cutting tissue. How about I use QSP mode? QSP is a finer cut. Remember, it's 100 hertz. Does it work? Absolutely it works. That's at 20 hertz. Look how fine that cut is. It's a purely clean, thin cut. So if you're trying to reshape bone, especially if you're doing it in the anterior crown lengthening, you want to use one of these settings. Maybe you want 50 hertz, depending on what you're trying to do. And if it's really thick bone and you want to remove bone quickly, you're going to want to probably use 10 hertz or 5 hertz. That's 15 hertz. And then finally we'll go to 5 hertz. This is QSP now. So 10 hertz QSP multiplied times 5 is 50 hertz. Remember that. And look how deep that cut is. Now we're bringing it to 5 hertz. Look how deep and clean that cut is. So if you're taking tauride off, this may be something you want to use. Think about that. Think about what you're trying to do. Look how deep that cut is. Again, this is at 25 hertz now. 5 times 5 is 25 hertz. There's QSP, there's SSP. See how deep the QSP is? So again, understand what you're using, okay? And if you're going to do cortical perforations, you're going to perforate like this. Because when you do that, you're going to create nice little holes, it'll cause nice bleeding. There's your cortical perforations. Okay, so if you're doing a ridge, same thing. You're going to do the cortical perforations like this. I'll be done in a few minutes, okay? See the cortical perforations right there? Again, you know how to do that. It's a lateral ridge augmentation. If you're doing something on the maxillary, again, the cortical perforations. You can see the bleeding points. This is something we did, a ridge augmentation. There's our titanium mesh, there's our bone. This is another one, removing a nasal palatine nerve. This is a conical tip, removing the nasal palatine nerve, so we can put an implant there, one point, go all the way to the nasal floor, right into the nasal palatine canal. Always warning the patient they may have some, numbness. That's what it looked like. There's one in the nasal palatine canal. That's at placement. This is 7 years later. These implants I didn't put back here. These are the only 3 I put in. Here's a cyst, taking cysts out. This is, I said, what are you doing with this? And the lady goes, they're watching it. I said, it was time they stopped watching. But here's our laser getting the cyst material out of there. We use PRF, we use bone. That's what it looked like at 8 weeks, that's what it looked like at 4 months, and that's what we got total fill. Removal of tori, okay? This is after you remove the tori. I don't care how you remove the tori, a burr, or anything. You use either a cylinder, a chisel, or a tipless, and you smooth the bone out in the floor of the mouth. Smooth the bone out in the floor of the mouth. Okay. Again, easy to complex. I don't want to put a rotary instrument in there. And finally, bisphosphonate necrosis, which is everybody's favorite. This is going in and removing dead bone. Okay? And you want to get it so there's bleeding. This is all dead necrotic bone. And this is the best way because you won't hurt the bone. Okay? It's water particles hitting the bone. So, in conclusion, remember that, like Einstein said, if you can't explain it simply, you just understand it well enough. So hopefully today I gave you a little bit of information of how different tips, different power durations, different power densities, all work on soft tissue and bone. Any questions? Thank you. Appreciate it.